Assalamualaikum and hello everyone. So our group will present about manufacturing in evaluation of experimental data in blood tests. So this is my team member Naha, Lukman, Vishmi and Danish and Iqbal. So we move to introduction. What is a blood test? Blood test is a medical procedure in which a small sample of a person's blood is taken and analyzed in a laboratory to assess health status. It is one of the most common and important diagnostic tools in medicine because blood circulates through the body and carries vital information about various organ, tissue, and overall body function. When we go to the clinic or hospital to explain to the doctor what our disease, of course the doctor will take our blood test. So why? Because with blood test, the doctor can diagnosing our illness. The blood test help doctor find out what illness a person may have. For example, if someone feels tired of all time, the test might show that they can have anemia or their sugar level is high. It can mean diabetes. Blood test also can detect nutrient deficiencies. For example, blood test can detect if we are lacking important nutrient. For example, a low iron level means we might have iron deficiency, which can cause tiredness. This helps doctor recommend the right food or supplement. Other than that is checking organ function. Our organs like the liver, kidney and heart release certain chemical into the blood. So the blood test can check if these organs are healthy or not by measuring those chemicals. And lastly is routine health screening. Even if we feel healthy, regular blood tests help catch problems early before they become serious. For example, high cholesterol may not show symptoms at first, but it increases heart disease
Thank you,
risk.
Rahman, for the beautiful introduction. Now let's jump to theory in our blood test. So there are RBC, which is red blood cells that work as delivery such as nutrition, vitamins, or antibody throughout our body tissue. For the white blood cells, WBC, they work to prevent the infection and helps the immune process. They also act as antibody in our body. For the platelets that suspend in plasma, they help to control the bleeding that go up from our skin. So where is the red blood cells come from? These red blood cells come from the center of the bone marrow that approximately produce 95% of red blood cells. So the cells will develop throughout the day and this process we call hematopoiesis process. So in other words, there are CBC, which is counter blood count. This counter blood count is a specific volume of the blood that we can get to measure the size, number, or the maturity of the blood in any types of blood. It is important to know our blood types in our body because there are four blood groups, which is Group A, Group B, Group AB, and Group O. So some of these groups have antigens and antibody. So what are the antigens? Antigens are found in the surface of red blood cells, which consist of protein and carbohydrate molecules. While for antibody, it consists of protein molecules that we call immunoglobulins that are found in plasma. So basically, antibody is to prevent antigen in one of the blood group or blood types. So for the blood group A, the antigen is A, while for B, the antigen is B. But for the antibody to prevent the antigen in group A is anti-B, while for the group B is anti-A. For the group AB, the antigen is A and B, but for the antibody, there are no antibody for the group A, B. For the group O, the antigen is no, but for the antibody for the group O is anti-A and anti-B.
Methodology for this part is: first, the patient is informed about the test and any necessary fasting. Identification details are confirmed and consent is obtained. Second, equipment are prepared before sample collections. Third is a suitable vein is selected. The area is cleaned with an alcohol swab. in a circular motion and allowed to dry to reduce contamination risk. Fourth is a tourniquet is applied to make the vein more visible. Using sterile technique, a needle is inserted into the vein and the required amount of blood is drawn into the appropriate tube. After the needle is removed, pressure is applied to stop bleeding, and a sterile bandage is placed on the puncture site. Each tube is labeled with the patient names, ID number, date, and time of collection. Samples are then stored properly and sent to the laboratory promptly. 7 is sample are analyzed using automated machine or manual technique depending on the test. Last one is the test results are reviewed by a medical professional and interpreted in the context of the patient health status.
Example of result. A typical blood test result includes a list of various measurements such as red blood cell count, white blood cell count, hemoglobin levels, and platelet count, along with their respective reference range. These values are compared against the reference range to determine if they are within normal limits. For example, that can be takes is a normal hemoglobin level for males is typically 14 to 18, and for females is 12 to 16, while a normal white blood cell usually between 4.5 into 11 exponent power of 3 cells.
So this topic conclude that the blood tests help us understand our health and detect problems early. They play an important role in preventing illness and keeping our bodies functioning well. Let's take charge of our health by living a healthy lifestyle and getting regular checkup. That's all.